3, 2, you're live.
Hello everyone, Dr. Weegriff here at Pure Plastic Surgery. We're going live for our Thursday Thoughts today, and I wanted to take a chance to talk about some of the tools in our toolbox that we have here at Pure Plastic Surgery for different indications and what we have available. Specifically for body contouring procedures like liposuction, BBLs, that kind of stuff. So surgeons love their gadgets and their tools, and we have a few great ones here at Pure Plastic Surgery, including one new one that is not in this room right now, but we'll talk about briefly. So we'll talk about just what exactly those tools we have, what I use them for, and when specifically a patient would benefit from using different devices for their procedure. So starting off with our trusty MicroAir, this is one of the most heavily leaned on tools in our toolbox, and the MicroAir is basically a mechanical liposuction device that, instead of just using a traditional liposuction cannula where you would go back and forth the entire time, the MicroAir is a oscillating mechanical device that takes some of the fatigue off of the surgeon and just allows us to do a little bit more work in a shorter time by oscillating back and forth very quickly. And so this is for traditional mechanical liposuction, meaning that after breaking up the fat a little bit, it's hooked up to a suction device and it's just sucking out the fat. And then we start talking about what can we do to improve that process, and we have the new device that we just got at Pure Plastic Surgery, which is the Vaser. And Vaser is an ultrasound assisted liposuction device that helps break up and remove fat from the surrounding structural tissues, and it allows us to do very precise things with liposuction that we might not otherwise be able to do as well with traditional liposuction. So this is especially helpful for patients that are getting any type of high definition liposuction, because we're really able to precisely see what we're doing and carve down those negative zones where we're trying to get definition. It also helps with bruising and edema following liposuction, because it's using that ultrasound technology to break it up with less mechanical stress on the tissues. So it really offers a lot of good benefits specifically for the right patient. It also has some degree of skin tightening, because this ultrasound technology does some degree of heating the tissue, so it can help contract the skin, decreases bruising, decreases kind of downtime related with the surgery, and we can use that fat to inject for BBLs and fat grafting. And then one of the other devices that we rely on heavily here at Pure Plastic Surgery is the Body Tight. This is another device that's really focused on skin tightening. And it's a bipolar radiofrequency device that again uses radiofrequency to provide a heat source to shrink down the collagen tissues in our skin and soft tissue, and this is what causes the skin contraction to happen. So for any patients that are maybe a little bit older, have a little bit of loose skin, or not the best skin quality, and we're trying to avoid certain things like tummy tucks, this may be a good option for you, and one of the things that we'll discuss in your consultation. Again, there's not always a substitution for a patient that needs a tummy tuck. If you need a tummy tuck, that just may be what it is, but if you're one of those borderline patients, we have some of these other tools to offer you and really tailor a procedure that's right for you. And then one of the last things that we have related to these procedures is the Cell Saver, and one of the things I love at Pure Plastic Surgery. The Cell Saver is a centrifuge device that actually spins down the aspirated fluid we get with the liposuction, so all the fat floats up in the canister, and then the bloody fluid that actually comes out that contains some of your own blood, we're able to recycle, centrifuge out the white blood cells and give it back to you, an auto transfusion. So you're not actually subjecting yourself to any of the risk of a traditional transfusion where it's coming from someone else. So there's no risk of rejection or anything like that, but we're able to give you back your own red blood cells and make sure your hemoglobin level doesn't drop too much with surgery. So not every patient gets this, but if you have a borderline hemoglobin that we identify in your preoperative evaluation, we may require you that you get this, or if just during the procedure it's a little bloodier than we would normally expect, we always have the option to use this to recycle that blood and give it back to you. That's kind of the big things I wanted to talk about in terms of our devices that we have here. Do we have any questions related to those devices or who's a good candidate for anything in particular?
Okay, let's start with the questions, Doc. Let's say, everybody's a candidate for a drainless tummy tuck?
Yeah, if you're a candidate for a tummy tuck, you're a candidate for a drainless tummy tuck. So I always reserve the right to leave a drain if I encountered something in the surgery that I found, surprising, or I'm concerned about something like an old seroma cavity or something like that. But that's very rare. And so basically anyone that's a candidate for a tummy tuck, they're a candidate to get it done with the drainless technique.
Okay, this question is about the cell saver, and is it mandatory to have cell saver for a surgery at Pure?
No, it's not mandatory, and frankly, if you don't need it, you don't need it, and we're not gonna incur the additional cost and other things if it's not necessary. But like I said, if you have a borderline hemoglobin level to begin with, it's definitely a good tool to help boost that level. Or if we just encounter a bloodier than expected liposuction case, we always have it as an option to minimize the risk of having to send you to a hospital and getting a transfusion or anything like that.
Can I use the Vaser lipo with my tummy tuck to the flanks? So I guess the lipo to the flanks for her tummy tuck.
Yeah, you could do that, and you would have to be a good candidate with specific needs to have that done. For most people, it's not going to be necessary to do Vaser liposuction to the flanks when you're getting a drainless tummy tuck. I just don't see a whole lot of benefit for that particular area with the Vaser. So in very specific cases, if I see you in your consultation, we may discuss it, but for most patients, they're just going to get traditional liposuction of the flanks.
Okay. Why are the drains necessary for some breast procedures?
It's very rare that I leave drains with most of my breast procedures, but different surgeons have different philosophies about that, and I'm never going to critique someone else's thoughts on when they want to leave a drain. But for me, typically breast augmentations will never get a drain. Breast reductions typically never get a drain. One of the times we may leave a drain is if we had to do a lot of capsule work, or if you had a capsular contracture and I had to remove a big portion of that capsule or do a complete capsulectomy. That may be a time I would elect to leave a drain, just because there's a lot of raw surfaces in those surgeries, and it may help with draining any fluid that would accumulate then.
Okay. Could you please talk about the recovery process after a drainless tummy tuck?
Yeah, so I've gotten this question somewhat recently, and the recovery process between the drainless technique and the traditional technique are very similar. The main difference is you just don't have the drains with the drainless technique. But in terms of overall pain and recovery, very similar between the two, because they're basically the same procedure. Again, the only difference is with the drainless technique, we do a couple extra layers of sutures where we are attacking the skin and fat back down to the muscle to close down that space where fluid can accumulate. And honestly, I think those progressive tension sutures actually speed up the healing a little bit, because then you don't have your skin and fat rubbing on top of the muscle, because it's all locked down into place, and the healing process can actually get started a little quicker.
Okay. Are those stitches absorbable?
Yes. So for my tummy tucks, at this point I'm not using any permanent sutures. So even for the plication, or the bringing together the six-pack muscles, even that suture is a long-acting absorbable suture that sticks around for about 6 months, but eventually will be absorbed. And same thing with my progressive tension sutures. That's why I always tell my patients, you might have some temporary dimples in your skin from those sutures, but it goes away as soon as the sutures dissolve.
Okie dokie. Let me go back. Okay. Okay. how I know if I'm candidate for a lipo 360 with a Vaser?
A good candidate for a lipo 360 with the Vaser could be anyone for that matter, because there are benefits to using the Vaser, like I talked about, potentially the decreased blood loss, the decreased bruising and swelling. So anyone could probably be a candidate for it, but specifically ones that want to go for a little bit more of the high definition or the soft etching of the abs, they're great candidates for the Vaser because it's really able to help us precisely carve out those areas that we really need to thin out for the high definition.
There's any BMI requirement for a Vaser procedure? Vaser lipo?
Not necessarily. Like I said, some of the benefit is for those patients that want to get a little bit more definition, so they tend to be on the lower BMI side, but there's also an argument for the amount of skin contraction it can give for patients with a little higher BMI, and also those decreased things like decreased blood loss and bruising. So basically just any of my BMI requirements are less than 34. If you're a candidate for liposuction, you're probably a candidate for Vaser.
That was the other question. If you could explain your BMI limits or criteria, please.
Yeah, so basically my BMI requirement is 34 across the board.
Okay, talk. So we're almost there. Rounding out of the questions, I'm going to the last one just came up. Okay, is there an age limit to have a tummy tuck with you?
At Pure Plastic Surgery, we have at least a soft limit of 60 years old. We like our patients to get clearance, but very healthy individuals that are over 60 years old, I'll consider doing their case on a case-by-case basis as long as they're healthy and no other major medical conditions. All right, everybody, thank you for tuning in. I appreciate it. We'll see you next Thursday.
Okay.